Okay, good afternoon. Thanks. You've heard this afternoon already that each year 1.35 million people die on the roads. And positioning this in a discussion about technology and enforcement, it's not really WHO's remit. High-income countries that can use many of the new technologies, I'll show you a couple now, are not our primary constituent organization. We're more focused on helping countries develop their health systems. And in this region, we're working actively with many of the ministries of health to try and improve road outcomes. So all that you hear about preventing crashes is absolutely critical. It's not our focus primarily, but what you hear about preventing crashes is critical, but while people are injured, they need care after their injury. And we know with the target, this Sustainable Development Goal target to reduce deaths by 50% by 2030, if the health outcome after the crash was the same in low and middle income countries as it is in high income countries, we would save those 50% of deaths immediately. So if people, when they have a crash, got the care that they could have, we'd save that 50%, or we'd hit the 50% target and save over 600,000 deaths a year. So there are many new technologies that can help us to activate the post-crash response system. You're wearing, I'm sure many of you are wearing something on your wrist that could do that for you. And with new cars, with driverless cars and with smart cars, the inbuilt algorithms will activate the emergency services. That's not the problem that we're challenged with. The problem is that there's not enough emergency services in most of the countries that we deal with. So even in this region, the ambulance services are very under-resourced, and it takes an incredibly long time to get to a crash. So these technologies are still some time away, I think, from actually impacting, when you've had a crash, impacting the ability to receive the quality of care that you need. There's a number of United Nations and other multinational body recommendations out there about what we should do, still breaking down from safe use and safe vehicles and safe roads. Post-crash care is still one of the key streams. We don't call them pillars anymore. We try and integrate. But it guides us on what we should do. So this safe system approach still has post-crash response in there. The advantage for when we're trying to advocate to ministries is that the response system that you put in place for road crash is exactly the same response system, an emergency care system that deals with COVID pandemics, that deals with heart attacks and strokes and so on. So there's a lot of efficiency. You don't need to spend money to improve post-crash care that is separate to the money you should be spending in your health system anyway. The care that people receive when they've had a crash, it either happens at the scene, at a health facility, or in follow-up. And as an organization, we've focused our support to ministries in all of these areas, apart from those focused on sort of legal or stress coaching. So we have a number of tools and support that we offer to ministries, to many of the ministries in the region, many of which are technology-based. So just to show you a couple that I'm unaware, sorry, who's in the audience, but if any of you are working with government, there are a number of tools that the governments can use to actually put the injury care system in place more effectively at very low cost, whether it's designing the packages that happen in an ambulance or at a hospital, or use of data. We've heard a lot about data already, but use of clinical data to work out where both the care that's delivered has got gaps, but also tying back to the earlier discussion about accident black spots. It's not just police data that can tell you about where the black spots are for a road crash. You can really tie in the clinical data that comes from a clinical registry. We also use up-to-date learning mechanisms. So phone-based or app-based, we've pushed out a lot of learning programs to try and drive both community first aid care and for improved care for health professionals who remarkably still in 2023 to say that in this region, most doctors and nurses do not get trained in emergency care, so they don't know how to manage an emergency, a life-threatening emergency. And we know that 50 to 60% of deaths each year in these countries could be impacted by better emergency care. And I've already said that's potentially 600,000 road deaths per year. We also know it's a very cost-effective part of the health system. So I would encourage advocacy and working with ministries to try and strengthen that post-crash component of the road safety agenda. Thank you.